Hi, everyone. Thank you for joining us today. So welcome. This is our UC San Diego InStep Center Pilot Funding Pre-Application Webinar. This is co-hosted by UCSD's Dissemination and Implementation Science Center. We're super excited to have you join us today so we can talk about this funding opportunity. A little agenda for today's webinar. Feel free to advance the slide, Liliana. So of course, we're going to start with some welcomes and introductions. We'll introduce ourselves and talk a little bit about this newly funded InStep Center. We're then going to give a bit of an introduction to team effectiveness research as well as D&I research. So this InStep Center, as well as the RFA, the funding opportunity, really prioritizes the application of team effectiveness research to the implementation of evidence-based practices for children's mental health. And I know many of you are probably familiar with dissemination and implementation research. Team effectiveness research might be new to many of you, so we wanted to offer a bit of an introduction to some of the concepts and theories to get you thinking about what might be appropriate for this funding opportunity. So then we'll dive into the pilot grant aims and logistics and talk about the application process, the review criteria, and we'll leave some time at the end for a Q&A, some questions and answers. Some quick logistics before we move forward, and I'm actually going to talk about the third bullet here first. So we are recording this webinar, and we intend to post it on the center website as well as our YouTube channel. And so by attending, you're consenting to be recorded in some capacity. If you desire, we encourage you to turn off your camera if that would make you more comfortable so you're not displayed in the recording. And we also want to encourage you to share your questions and comments in the chat, and you may enable live closed captions on your Zoom toolbar if you wish. So we'll jump into some introductions. I'll briefly start us off, and then we can pass it on to others here today. So I'm Marissa Sklar. I'm a clinical psychologist and program evaluator. I'm a co-lead of the methods core for this InStep Center. And I'll pass the baton now to Lauren to introduce herself.
Thanks, Marissa. I am Lauren Brookman-Frizzy, and I am the InStep Center Director, or one of the InStep Center Directors, and lead the administrative core.
I'll go next, going from left to right here. So Greg Ahrens, great to be here with you all. I am co-director with Lauren of the InStep Center, and also director of the methods core. So I'll pass it over to Sean.
Hi, I'm Sean Burke. I'm an industrial organizational psychologist, and I'm at the University of Central Florida, and I'm one of the methods core co-leads. I'll pass it on to Nicole.
Great, thanks. Hi, everyone. I'm Nicole Stadnick. I am an implementation scientist and clinical psychologist. I am one of the co-leads of the admin core along with Lauren. Thanks.
Yeah, thank you all. And just for the sake of time, we're not going to ask you all to introduce yourselves, but we really want to know who you are and where you come from. So please feel free to introduce yourselves and give us your name and affiliations in the chat so we can see who's joining us here today. And with that, I'll pass again the baton over to Lauren, who can tell us a bit more about this newly funded InStep Center.
Thanks, Marissa. Just in brief, the focus of the research of the center is on developing and testing team-based implementation strategies. And we're going to be talking about the development of team-based implementation strategies and the focus on teams in a few minutes, but really where we're grounded is in children's mental health. And so all of the research that is conducted through the center is intended to address the public health priority of children's mental health and for children with mental health and developmental needs. And the settings for our team-based implementation research are really multiple public service systems that are involved in caring for children with mental health and developmental needs. So our planned research are in schools, outpatient and school-based mental health services, child welfare services, and medical services. As you are developing your proposals, there may be other publicly funded services that care for children with mental health and developmental needs. And we welcome that as well. That our initial research is really focused on these 4 service systems. I'll turn it over to Greg for the next slide. You're on mute, Greg.
Details. So yeah, so the reason for this and many of the Alacrity centers is because multiple evidence-based practices have been identified as effective, but they're not routinely used in routine care. And some of the sectors that Lauren mentioned are kind of the ones we're focusing on right now, but other sectors such as juvenile justice, anywhere that kids with mental health issues can be reached, which is kind of fair game. So think broadly as you're thinking about your proposals. But our center and the focus on teams is that team and teamwork are essential to providing services in many settings. But we often don't think about the effectiveness of these teams and how we can really maximize that effectiveness. So our focus is on integrating team effectiveness research, and implementation science has the potential to accelerate the care quality and effectiveness. And so we want to bring what's known about team strategies, team effectiveness from other fields to children's mental health. Next slide. So we have our InStep Center website, and the address is here, instep.ucsd.edu. So you can check our website, which we're continuing to build and grow, for more information and resources about the center, and also about our opportunities for seminars, for consultation, for other services that we provide.
Thanks, Greg. So we hope you've all seen the request for applications. You can, the RFA is linked on the website, or you can click on the QR code here. We really encourage you to, as you're developing your applications, to review the RFA thoroughly and to look at how we're evaluating applications. We're going to move into now an overview of team effectiveness research and then implementation research in order to really provide some primer on some of the key elements that are in the RFA. And I'll turn it over to Sean.
Okay, thanks, Lauren. So I think in a minute you're going to see a Zoom poll that probably appears in the chat. That's going to ask you, it just popped up, that is going to ask you what your current experience level is with team effectiveness research. And if you guys could take a minute, respond to that. It looks like most of you have responded. I'm not sure if you can see that on your screen, the results, or if that's just on mine. So I will, it looks like most of you have responded, and about 47%, actually it's kind of split half and half. 47% of you are novices in the sense that you haven't engaged in any team effectiveness research. And then about the other half of you have beginner skills, and there's maybe one or two of you that have done some team effectiveness research in the past. So let's see, stop sharing that. So thank you very much for that. That gives us an idea. I'm going to give you a very high level overview of team effectiveness research. If you were at the kickoff, some of this might be redundant, but it's a lot of information. So hopefully the idea is to kind of get you interested and kind of get you thinking about how some of this stuff might apply to some questions that you might propose within the RFAs. So you can go ahead and go to the next slide. Okay, so I'll briefly touch on some key developments going into kind of how teams function. And then I'll talk a little bit about a conceptual model that we're using in terms of how this stuff applies to the center. And you'll see that come up also throughout the presentations, as well as within the RFA. And then I'll end by talking just a little bit about team measurement and then some concluding thoughts on main points I hope you got out and kind of where the field is going. Next slide. You can hit it one more time. So what I wanted to start with was just kind of setting our boundaries. So when we talk about teams, we make a distinguishment between teams and groups, where teams are collectives who exist to perform organizationally relevant tasks. They share one or more common goals. They interact socially and they exhibit task interdependency. The other thing to take away from this definition is they're embedded within an organizational context, and that context influences and constrains the teams with regards to their exchanges and how they work together. So a couple of things that I want you to pull out from this. It's generally two or more individuals. They're working towards common goals. Now, that does not mean that there is no conflict or that teams don't have sub-goals. Sometimes they do, but there's at least one shared goal that they're working towards. The other thing is the notion of task interdependencies, and I'm going to hit on that more in a minute. But if the team members are not interdependent, if they do not have to rely on one another in some way to work on the task, it's not a team. And then the other thing that you'll see me kind of talk about is it's really important to think about not only the organizational context that your team is embedded in, but also the characteristics of that team itself, because that'll help us to understand what are some likely problems that the teams may have, and therefore what are some likely interventions. You can go ahead and go to the next slide. So when we talk about task interdependence, I really don't care that you know exactly what the names here are, but I want you to get the idea that we really need to think about this. This is a typology that was put forth by Saavedra and some of his colleagues. And if we start at the top, pooled is really independent workflow. I would argue that that's not really a team, that's more like a group. So input comes in, people work on things, and then they have this shared output. So think about some brainstorming groups are like this. People just throw ideas up. When you really start getting into more what I would consider a team or these other forms, sequential means that the work is going one way. So think of an assembly line. That's kind of the best example. I work on something, I then hand it off to somebody else. They work on it and hand it off to somebody else. Reciprocal is two-way workflow. So two individuals on the team and that work is flowing. They're interdependent with each other, if you will. And then kind of the highest form is this notion of team or intensive, where there's lots and lots of interdependencies going on. They're going on simultaneously within the team. And the reason this is important is because the stuff we're going to talk about, the closer you get to kind of the bottom of this list, the more relevant this stuff becomes important. Okay, the more I have to depend on my team members, the more this stuff is important. You can go to the next slide. The other thing another development that people have talked about a lot are team types. So we can all think of, there's multiple types of teams that we've all been exposed to. And those teams all have different characteristics. And so there's been a fair amount of work that's tried to categorize teams into buckets. Here are some of the taxonomies that are out there if you're interested. Exactly agrees on all the labels. What people have begun to say is more important is thinking about kind of those underlying dimensions, right? Thinking about the characteristics of my team. And this is some work by Hollenbeck and his colleagues, which represents kind of where the field is at right now. And they would argue what you see here is that when we're thinking about teams, think about them within this three-dimensional space. And I need to think about the degree to which the temporal stability of my team. Do I have a team that's very stable? Do I have members that are kind of rotating in and out? And he's kind of plotted this, you can see on this three-dimensional axis. The team types that are on here are exemplars. So that doesn't mean your team couldn't move right or the left, but these are just some examples. He also would say that we need to think about the amount of authority differentiation within the team. So how hierarchical is the team? Do you have a really flat team where there's not a lot of differentiation between authority levels, or do you have more of a hierarchical team, like a hierarchical decision-making team, like a military team, like some of the surgery teams, for example? And the other axis that you see kind of cutting across the diagonal there is skill differentiation. So how much skill differentiation is there on the team? Do we all have similar levels of expertise, or are we really this more cross-functional team where we've got different types of skills on the team? The reason this is important is because it begins to point, again, thinking about the team characteristics begins to point us to where I might have some potential challenges. So if I've got a team that's constantly turning over, then you'll hear about this a little bit later, but then it's harder to maintain some of the team cognition things that we know helps teams to coordinate because of the membership turnover. If I've got a team where there's a lot of skill differentiation, for example, maybe then I'm thinking more about information exchange, because it's very common that on those teams, people speak different languages and may not be aware of what everybody's expertise is in order to take advantage of that. Next slide. Okay. So another key development within the team literature are models of team dynamics. So early on, we kind of focused on this idea of inputs, processes, and outputs, and that black box that was just in the middle. Early on research, we didn't pay attention to what went on in the middle here, right? So the focus was on, go back. The focus was on trying to understand trying to understand some of the inputs. So the member characteristics, the team characteristics, task and work characteristics, and how that impacted the quality or what the team was actually producing. And early on, the focus was really on quantity and quality. As the field progressed, we see those outputs that we now pay attention to have really expanded. The thing that I really wanted to drive home here is we knew about inputs and that inputs impacted how the team worked, but we didn't know how they got from point A to point B. We didn't understand the why. And so probably the past 40-ish, maybe years, has really been spent on trying to unpack this middle, which is really important if we're talking about interventions or training, to understand why are they getting from point and how are they getting from point A to B. There's lots of things here. Whoops, go back one more time, not done. There's lots of things here, but what I really want you to take away from that model, not so much the constructs, we'll talk about some of these, but the way teams do their work are through processes and states, emergent states. Processes refer to kind of the behavioral interactions that occur while I'm working on the task, so communication, coordination, leadership. These processes impact how I think and feel about the team. Those are the emergent states. So things like trust is an emergent state. They change over time, but they don't change as quickly as our processes do. These emergent states both are an outcome of how the team works together and impact our team effectiveness outcomes, but they also serve to come back around and impact and guide how you work with the team next time. You can go ahead and go to the next slide now. So another way to think about this, perhaps a little bit simpler, is teams work through the ABCs of teamwork. So the teams get their work done through attitudes, behaviors, and cognitions, where the behaviors are our processes and the attitudes and cognitions are our emergent states. And I want to go into a little bit more about some examples of what some of these things are. Next slide. So when we're going to start off with cognition. So if we're talking about knowledge requirements, the first three things that you see on this slide really reside more at the individual level. And that third bullet, task proficiency, is what most organizations focus on. And they think if I take a lot of people that are really good at their job and I put them together, they're going to work well together. And oftentimes that's not the case. So it's a necessary but not sufficient condition. But if I don't know my task, it's very hard to work well together on that task. The second thing I'll point out from there is roles and expectations. Very, very important that team members have a clear understanding of what their roles and expectations are and how the team is going to operate. That's something that often falls off within organizations and causes a lot of conflict and confusion within the team. The last three things on here are collectively known as team cognition. And I'm going to go into a little bit more depth on these because they've really been argued to be kind of the foundational mechanisms that allow teams to coordinate and adapt. And if you can go ahead, we're going to start with talking about shared mental models. So shared mental models, there's lots of research on this. And basically it talks about the degree to which team members hold compatible mental representations about the equipment that they're working with, the tasks that they're doing, and the team members that they're interacting with, and how that work should proceed within the task and the environment. The degree to which they hold similar ideas about that, it facilitates coordination. The best example, or the stereotypical example, is kind of the blind pass in basketball. She doesn't need to turn around and say, hey, Jane, are you going to be there? She knows, because they have a shared representation, that they're in this type of situation, Jane's going to be back there. You can also think about, I recently went to the dentist, and the degree to which the dental hygienist is proactive in handing the dentist the tools that he needs, or does he have to continue to ask, or does she maybe hand him the wrong tool, might indicate that maybe their task mental models aren't exactly there yet. Next slide. Shared mental models are important. Like I said, by having those compatible ideas about how the task and how the team's going to operate, they allow me to predict what my team member is likely to do, and they also help us to explain environmental events. And it's been shown time and time again to predict performance, especially when we start getting into situations where communication might be degraded, either because of it's a noisy environment, or we may not have a lot of time to sit there and say, hey, Lauren, Marissa, I need you to do this. So they're very important in those type of situations and allowing the team to adapt and move forward. Next slide. The second cognitive construct, this again, we're talking about cognitive emergent states here, are transactive memory systems. These within teams, one of the real cool things about teams, right, is that I can take a whole bunch of different people with different types of expertise, and I can have them tackle a problem. And hopefully, because I have those different types of expertise, we come up with some type of better product. But in order to do that, we need to have an awareness that what unique information that team members hold and what their areas of expertise are. And that's kind of what transactive memory systems speak to, is the idea of team members having this knowledge of who has what unique information about the task, who has what types of expertise, and then an awareness that we all know that. And if you go to the next slide, this has been shown, it helps in several ways. Number one, like I just said, it allows me to know who knows what. That helps when I'm passing information, so that I don't overload or misdirect communication or information to a particular team member. It also might allow me to better understand if I'm having an issue, who do I go to? Again, I don't need to know everything, but I need to know where I can reach out to find that information. And then on more of the kind of empirical side, it's been shown to be related to team learning, to team knowledge transfer, that's information sharing. Teams that have transactive memory systems tend to have greater belief in the team's ability to succeed. That's collective efficacy. They tend to be more satisfied, and it tends to be related to team effectiveness. Next slide. The last cognitive construct that I was going to touch upon is situation awareness. If you're interested in this, Micah Ensley is the go-to person. I should have said transactive memory. Kyle Lewis is a key name there. Situation awareness, again, if we talk about it at the team level, it's team situation awareness or shared situation awareness. And it really refers to the degree to which I have an awareness of what's going on in the environment at any particular point in time and what that means for the work that I'm doing. And that allows me to kind of project forward. It's been argued and been shown to be essential in decision-making. I would also argue that it's essential in terms of guiding teams, in terms of if they need to adapt their actions, it's kind of the trigger. Something's changed. If I'm not aware of that, or we don't have that shared awareness, and sometimes you get a lack of coordination. Okay, next slide. That was the fly through of team cognition. We're going to switch for a second and we're going to go to skill requirements. So these are our processes. There are other ones that are out there. These are some exemplar ones. I'll touch upon a few of them. So team leadership is a huge one. We talk both about hierarchical leadership within teams, as well as leadership being distributed throughout the team, and the notion that a lot of what team leadership does and team leaders do are set or create the conditions that allow teams to perform well. Another thing that good performing teams do is they tend to engage in mutual performance monitoring. So they keep an eye out on what other team members are doing. And as long as there is trust in the team, which we'll talk about in a minute, then that's a good thing because it allows them to catch mistakes and to see when people begin to struggle, and then they can step in and offer support or backup behavior. Now that may be verbal, it may be actually physical backup behavior, depending on the team and what's going on. The important thing here is the literature would argue that if that backup behavior isn't actually needed at that time, it can actually hurt the team. So again, it goes back to kind of having transactive memory systems and having an awareness of what's going on. Conflict resolution, we also talk about. So if you're within teams for very long, you're probably going to have some type of conflict. So one of the key skills is being able to resolve that and trying to keep it focused on the task and not let it evolve into interpersonal conflict. And then we also talk about closed loop communication, which is a form of communication that allows the sender to know that the receiver has gotten the message that I sent and it actually understands that message. You can go to the next slide. On the attitude side, so these are the effective emergent states. These are, again, some of the most common ones. They've all received quite a bit of research arguing for their importance. I'm going to focus on three of these for today, because I think they're especially important when we start talking about mental health and dealing with children and those type of teams. So if you can go to the next slide, we're going to start off with team cohesion. So this is probably one of the most well-researched constructs in the team domain. There's several meta-analyses on this if anybody's interested, but it really talks about the bonding together of members, I'll say of a team, but it can be any collective, the bonding together of those members. And what it serves to do is it serves to produce extra effort. This is team cohesion is what allows you to, or what makes you want to continue to work on that task when you've been up for 24 hours and you just want to go to bed, right? Or you've come across something that's really, really difficult to do. When we talk about team cohesion, we talk about two different facets of it, two different subdimensions of it. We have task cohesion, which is my attempt on the left-hand side there. Task cohesion talks about I'm bonded to the team, but it's around the task that we're doing. I think the task that we're doing is meaningful and important, and that serves to bond me. The other one that we talk about is social cohesion. That's my right hand over here. The right hand picture with the people looks like they have done a ropes course or something. And that's more about bonding based on, I'll say, interpersonal attraction. I like the members of my group. I think that they're a good group of people. They're not out to get me kind of thing. Both types of cohesion have been shown to be important, and oftentimes they're measured within the same scale. Next slide. The reason we care, I kind of alluded to this. So it's been shown time and time again, it facilitates performance, facilitates team members offering support, information exchange within the team, and you tend to have lower team conflict. And it's just generally people enjoy working with teams where there's a higher level of cohesion. Next slide. Trust is the second effective state that I wanted to focus on. I think we all kind of have an idea of what trust is. It's not that different at the team level. So it's about a willingness of a party and a willingness of somebody to be vulnerable to the actions of somebody else. You expect they're going to do what they told you they're going to do without you having to monitor them. So key things here are there needs to be some degree of vulnerability or risk to me in order for it to really be about trust. And if I'm sitting there looking over the shoulder, then that's probably not trust either. When we talk about it within teams, you can go to the next slide. When we talk about it within teams, we talk about trust foundations and how does trust evolve in teams. And there's two primary ones. So when a team first gets together, the first type of trust that tends to emerge is cognitive-based trust. And that's based on my knowledge about my team members' competence, their integrity, their reliability. Do they have the skill set that I think we need to accomplish this task? Are they, are they reliable? Are they dependable? After cognitive trust emerges, what tends to follow that is affective trust, which is based more on the emotional investments. I believe my team members have a genuine care and concern for the other members of the team. Cognitive and affective trust tend to be interrelated, but both take time to develop. So this third foundation has emerged, I don't know, probably within the last, I'll say maybe 10 to 15 years, this notion of swift trust. And it begins to speak to what happens when we have a team, they don't know each other very well. They're put together and they're told, you have to go work on this problem like now. And that's this notion of swift trust. So it's trust that's often built on superficial cues. And these superficial cues or surface level cues often serve as markers for reliability, dependability, might be status symbols. And it serves as I'll say kind of a proxy and an initial level of trust until I now get more experience with the team that some of these other forms take off. You can go to the next slide. The last thing I want to mention is psychological safety. This to me is super important, and it's Amy Edmondson is the go-to person here. And this has received lots and lots of attention within the last several years. So it talks about a belief that the team is safe for interpersonal risk-taking. So I can speak up, I can offer feedback, I can offer my opinions or my perceptions of something without fear that there's going to be any type of retribution, whether it's formal or informal retribution. And when you're talking about high-risk environments or highly sensitive environments, this is super, super important. So it's related to trust in the sense that trust is about giving the other person the benefit of the doubt. Psychological safety is kind of inward focus, and that I believe others are going to give me the benefit of the doubt. A lot of the work that's been done here has been done within medical settings, as well as high risk action-oriented kind of teams. And several years ago now, maybe 3 or 4 years ago, Google did a study showing that it was one of the top 5 things that differentiated their high performing from their lower performing teams. You can go to the next slide, I think. Okay. So if we take all that together, members of our team here have worked to kind of come up with this conceptual model of team effectiveness to try and show how this walks through when we talk about evidence EBP implementation. This is being used within the center for our current projects as well as for future projects. Let me walk you through this fairly quickly. So you start off with your clinical or your service EBP. Right now that we're dealing with teams, we're also going to think about our team input. So we're going to think about our member characteristics, our team characteristics, as well as the task characteristics that are related to that EBP. That's going to serve to begin to inform our implementation. But now we're talking about the team, right? So we also need to think about those team mechanisms that are over here on the right-hand side. And given our inputs and your EBP, think about, well, what are the likely areas that my teams might falter? That's going to drive that team enhanced implementation strategy. Then once you have that, again, they're targeting some of these team processes. So hopefully that team enhanced strategy facilitates some of these team mechanisms, which then translate into outcomes, both implementation and clinical services outcomes. And then if you go to your next slide, I know I'm coming up on my time, but really quickly, I would just want to briefly talk to you about team measurement. Because these are some things you need to be thinking about when you're putting your proposals together. So in general, we do a lot of surveys when we talk about teams, self-report surveys, Likert scale surveys, and they have a number of issues. But that cuts across the board here. When we talk about team process, we also sometimes do observer ratings. So we may use behavior observation scales or behaviorally anchored rating scales, where you have your scale and then you're, good psychometrics contextualizing what each of those levels mean, what's a high, what's a low. We also do a lot with team communication. So we actually record the team's communication in a number of different ways, a number of different types of team communication, then go back and traditionally we have hand coded that for different processes, which is very labor intensive. And so there's a lot of emerging work going on, some within our center, that's looking at how can we use machine learning and linguistic analysis to also facilitate that. If you go to the next slide. In terms of cognition, I'll start with the situation awareness stuff. If you go back one, if you start with the situation awareness stuff, that's been measured primarily in 2 big ways. One is surveys, asking people after they're done to reflect back. The other one is SAGIT, which is a freeze technique where teams are stopped in the middle of at some point during their task itself. So while they're working, and then asked to reflect back on situation awareness concepts. If you're dealing with a simulation, some of those questions can be embedded so they're not as obtrusive that you're really stopping the team. But those are kind of the key techniques there. On the shared mental model side, there are surveys. Those are embedded in the slides. You can see those later. But what I wanted to focus on were these first three because they're a little bit different. Let me see if I can get through this. You can go ahead. So card sorts are one method. Here you would have I'll say your content ideas. If you guys can see my cursor up here on the top left-hand side, if you were doing if you were looking at task mental models, you might do a task analysis and then have what are the key points about my tasks that are important for the team to know. Those would form kind of your content ideas. And then basically you ask team members to independently sort those into thematic piles. Now you can do that with as much or little structure as you would like. Sometimes people just say, here's the concepts, sort them into piles and label those piles. You can say, I want you to sort them into 4 piles, or I want you to sort them into 4 piles and here are the labels. So you can decide how much structure you want to provide to that. And then later you can go back and do analyses looking across your team members to see how much they align in what they did. It's probably more often used for content versus procedural type of things. Next slide. Paired comparisons are another technique. Ben and Chong is one example of people that did this. So this is literally what it says. You take your concepts, and if you have 10 concepts, you're asking your participants or your team members to individually, how much is coordination related to communication? How much is it related to leadership? So you're actually doing all these dyadic comparisons, usually on a Likert scale, 1 to 7, 1 to 9. It does get very cumbersome. 14 items to me would be a lot because you're doing 14 by every other thing. So we try to usually keep it to 10 or below. The nice thing about this is, in addition to getting kind of quantitative metrics, you can also get some network metrics that pop out that will show you kind of what people see as most related. So this comes from some work that I've done. In this case, this person thought that member similarity and backup behavior and communication is really important to effectiveness at this point in time. Conflict management, less important, for example. Next slide, and I promise I'm almost done. The last one is concept mapping. This tends to be used more for procedural kind of things, or where you kind of have these flow diagrams. Again, you can do it with more or less structure, but like in this example down at the bottom, I may have started off with something that said goals, and maybe I had the structure mapped out and they're taking their concepts and putting them into this. You can also put propositions like you see on the top. And if you're really brave, you can ask them to create their own concept maps. But that oftentimes gets a little hairy. But anyway, so here's a different type of method, and then you can go and there's metrics that you can come off of that. So yeah, that's okay. So next slide. So where we've been, I've thrown lots of stuff at you guys, I know, but we have lots and lots of knowledge on what makes effective teams. There's been lots of tools developed, lots of instructional strategies, which you'll hear about a little bit later. Where we're going, so focus on unobtrusive metrics would be key for helping out the team's domain. Focuses on dynamic assessment. We tend to do pre and post, but really don't have an understanding about how these things change at a more nuanced level. And because of that, we're also incorporating tools from other areas. So you see an emphasis on social network analysis, machine learning, and more advanced statistical procedures to pick up on that dynamic assessment part. And I think that's it for me. And I will turn it over to.
I'll take it next. Thanks, Sean. Hopefully everyone's creative juices about teams and team effectiveness are flowing. I will take us through, I think, a brisk walk or jog through some key dissemination and implementation research concepts that are really critical to our RFA. Next slide, please, Liliana. So a couple of definitions just to set the scene. Again, we appreciate that many of you who are on the call now and who are applying are pretty familiar with many of these concepts. These definitions come from the program announcement at NIH. So dissemination research, it's the study of targeted distribution of information and intervention materials. Really the focus is on kind of how to best share evidence and evidence-based practice kind of uptake. Implementation research is the study of how to use strategies, including team-based implementation strategies, to adopt and integrate evidence-based practices into routine care settings. And then putting them together, dissemination and implementation research, broadly, it focuses on interdisciplinary cooperation and transdisciplinary collaboration. So perfect for thinking about teams and team effectiveness. So drawing from a variety of fields and methods, again, to inform the successful integration of evidence-based practices into routine care settings. Next slide, please. D&I science, it's a translational science that cuts across from benchside to public health settings. And we're really interested in seeing applications that do cut across these different translational components. Most likely, we're expecting that you'll be focusing on the kind of T3, T4 practice-based public health impact settings. But we do want to just acknowledge that there is space and place for applications that do talk about studies that are more formative or in kind of earlier translational stages. Next slide, please. So some key ingredients of D&I research that we have also emphasized in the RFA. We expect that you have an evidence-based intervention, practice, program, or policy that you're focused on. We also expect that you'll be talking about and incorporating a D&I theory, model, and framework. More about that in a couple of slides. We also expect that you'll be thinking about either developing, adapting, or using a D&I strategy, and most specifically a team development intervention or team-based implementation strategy. And then finally, we're also expecting that you will be assessing and explicitly measuring outcomes related to implementation, team mechanisms, and other concepts like that. At the heart of your applications, we do really encourage you to think about how you're engaging your partners, including community partners from different care settings, or other members of a team, in a clinical context that you're hoping to engage. Okay, next slide, please. So a little bit more about D&I strategies. There are a couple of different definitions that we tend to use. I think the one that often we talk about is a systematic intervention or a bundle of interventions that are really focused on how to adopt and integrate evidence-based healthcare interventions into usual care. And I think if you press one more time, Liliana, we see some really familiar kind of lay language about how to describe these terms. One more time, there we are. So based on language from our colleague, Dr. Jeff Curran, the intervention, practice, or innovation evidence-based practice that we're hoping to see that you're focused on is the thing. And then implementation strategies, including team-based implementation strategies, are the stuff we try to help people and places and other contexts do that thing. We do have a few more slides that we'll be sharing with you that give more examples of some of our team-based implementation strategies. And I think we will discuss this a bit later in the webinar, but we just want to kind of prime you to start thinking about implementation strategies and how they might look in a team-based context. Next slide, please. Okay, so speaking now of theories, models, and frameworks, we do expect in your applications that you explicitly talk about how you will be integrating a theory, model, and framework. In particular, our conceptual model of team effectiveness for EBP implementation that Sean really beautifully described earlier. You are welcome to also integrate or combine use of another theory, model, or framework in addition to the team-based implementation model. Just for some quick definitions of theories, models, and frameworks, they're often described interchangeably. they do have some differences. Theories are really focused on explaining an implementation situation or context. So examples might be the normalization process theory or the diffusion of innovation theory. Models are more prescriptive. They tend to describe a process of how you do something. So examples tend to be the adapt-it model or the knowledge to action model. And then finally, frameworks, they tend to provide kind of an overall view of different variables or factors that may influence a process or success or non-success of an implementation effort. So examples include the exploration, preparation, implementation, sustainment framework, and the consolidated framework for implementation research, CEPR. Next slide, please. Okay, so as we've mentioned earlier, in some ways we've made it your job a little bit easier in that we have sort of pre-selected this framework that we are requiring that you incorporate in your application. So again, this is the conceptual model of team effectiveness for EDP implementation. You do not need to measure all aspects of this model. It's way too much for any one project, especially a one-year project to handle. But we do want to see your kind of explicit identification and rationale for certain components of this model in your application. Next slide, please. Okay, and then again, last but not least, we do want to understand how you are meaningfully engaging partners as part of your application. So this figure here just shows how partners can be found in communities, settings, with providers, and with clients or consumers. And they're really pivotal to informing your selection of the evidence-based practice, how you're thinking about implementation strategies, and then ultimately your implementation, service, and patient outcomes. So we have a section that we'll describe a little bit later where we ask you to talk about your engagement with partners and the impact of your study on different partners and settings. I think the next few slides, we have just a couple of resources that we wanted to share, I think really specific to measurement. So if you're looking for ideas about how to measure some of the D&I constructs and some of the team-based constructs, these are some good resources. So this, the slide, the previous slide, this one here, this is a paper, a short report that offers some measurement resources for D&I research and health. The next slide is the Society for Implementation Research Collaboration Instrument Review Project. You do need to be a member to have access to this, but it's a really nice comprehensive library of measures, mostly tied to the CEPR framework. Next slide, the one prior is the grid-enabled measures database. This is a free library of measures. They do ask it that you create a free account so they can track who's accessing the database. But it also is a nice searchable library of implementation measures that you might consider. On the next slide here, we wanted to share that the NIH has a team science toolkit really focused on the science of teams, and it can also provide you with some ideas of measurement. Okay, and I'm coming up at the end of my time. I think this is my last slide before I turn it back to Marissa. So our D&I Science Center has also developed a few one-pagers, kind of brief overviews of basic terms in D&I research, training opportunities, and other resources. So we have a couple of QR codes here that you're welcome to access if you'd like additional information about D&I basics. So with that, I think Marissa will hear more about the pilot aims and logistics.
Yeah, thank you, Nicole, and thank you, Sean, for the intro to team effectiveness research. So yeah, let's now talk about the pilot grant funding opportunity. Here is just another link to the RFA. And like I mentioned in the chat earlier, we are going to make these slides available to each of you so you can reference them later if we don't, get a chance to fully talk about some of the things that are in here. So absolutely, all of these links and QR codes you'll be able to access later as well if you can't at this very moment. So the aims of the pilot funding, we have 4 main aims for this pilot. So the first is to stimulate D&I research focusing on optimizing team effectiveness in implementing EBPs in community-based systems serving children with mental health needs. I hope that's pretty clear given what we've been presenting so far. The next aim is to generate data that will lead to success in garnering major research funding like NIH, PCORI, IES funding, or any other agencies or foundations that fund implementation science for children's mental health. So this can really serve as a stepping stone to additional funding or research projects focusing on team effectiveness research in implementation for children's mental health. The third aim is to support the career development of early career investigators in D&I. So there is going to be a prioritization here on junior investigators, and particularly among individuals from groups underrepresented in federally funded health services research. And then the last aim is to increase the public health impact of EBP implementation efforts in community care settings that serve children with mental health concerns. So we wanted to give some example research questions that this kind of funding could be used to answer. So on this slide, we have just some sample research questions, and we'll talk a bit more about what that might look like in another slide. These, of course, are not comprehensive, but we wanted to just get you thinking about the kinds of research questions that may be appropriate for the scope, the timing, the budget for this pilot funding opportunity. So first question, how can we measure team effectiveness in children's mental health services in an unobtrusive and pragmatic way? Like Sean mentioned earlier, the field is really hungry for unobtrusive and dynamic measurement. So can we apply that to children's mental health services? Similarly, what data are available and or can be collected to assess team effectiveness in children's mental health services? Additionally, can we use secondary data analysis to advance team effectiveness theory and application in children's mental health? So this is very much, these 3 example questions are very much measurement data focused and applying measurement of team effectiveness constructs to children's mental health settings. The next sample research question, maybe you want to select a team intervention and apply it to address an implementation challenge in children's mental health. Similarly, maybe you want to engage community partners in the development or adaptation of a team effectiveness intervention for a future implementation effort. So if we go to the next slides, we are providing here a table, a lot of information in this table. Again, this is why we want to make the slides available to you after this webinar so you can take a look at it in more detail. But we wanted to offer some sample team development interventions that you could consider adapting for implementation of EBPs in children's mental health services. So we have some sample team development interventions listed here on the left of the table under the TDI column. You can see team charter, team task analysis. There's a brief description of each of these team development interventions and whether the intervention really focuses inputs, processes, or outputs. So going back to what Sean was describing earlier in terms of the model, we can see that some team development interventions may be more appropriate for targeting inputs versus outputs, and then some importance there. So there are 2 slides just giving some sample team development interventions. You could think about maybe the implementation challenge that you want to address and what sort of team effectiveness constructs need to be addressed in order to target the challenge and address the challenge and come up with a team development intervention that most appropriately targets those challenges. You can go on to the next slide. So a proposal example listed here. So if we were to think about how we might go about crafting a proposal that addresses one of those research questions that we listed earlier, we came up with this example. Completely hypothetical example. So if anyone has connections with LAUSD, and if this is totally wrong and not at all consistent with what they would want to do, I totally apologize. This, again, is just made up hypothetical example. So that being said, an example project that you might use for this pilot funding, say the LAUSD, Los Angeles Unified School District, they want to implement positive greetings at the door as a district-wide positive behavioral interventions and support initiative. So they have these plans to do this district-wide implementation of a particular practice, being positive greetings at the door. And in order to inform this broad implementation effort, there is one elementary school that is going to pilot the implementation first. So in partnership with LAUSD and this elementary school, your proposal aims to conduct a mixed methods needs assessment of team processes and emergent states that might impact fidelity of PGD implementation. And you hope to then use the information from this needs assessment to inform future research wherein the development of a team-based implementation strategy will guide and test the district-wide PGD implementation. So we think this, an example like this might be appropriate, again, in terms of scope and funding. It's sort of developmental in nature to inform future research initiatives, research efforts. There's a clear partnership between the research and the community of interest, and definitely addresses the team effectiveness constructs that we have included in the conceptual model. Go on to the next slide. So we also want to make clear how the proposals are going to be reviewed. And all of this information is included in the RFA in more detail, actually. So I would encourage you to take a look at the RFA and really make sure you read through everything. But again, we're just going to talk through it a little bit here. So the proposals are going to be evaluated by 3 mass reviewers using 3 scoring systems. So the first scoring system is the one I think most of us are familiar with, the NIH scoring guidelines, where a 1 sort of indicates a high impact proposal, 9 would be low impact proposal. There are the different categories that are reviewed in terms of environment, investigators, research, all of that. And that would account for 30% of the total score. Proposals are also going to be scored using the implementation and improvement science proposal evaluation criteria, INSPECT by Crable and others in 2018. And we'll talk a little bit about that in the next few slides. And that would account for 40% of the total score. And then finally, there is a community-based review that includes 3 grading criteria centered on community engagement, the strength of community partnerships, and short and long-term community outcomes. And that will be 30% of the total score. A little bit more detail about the INSPECT criteria. So again, you can access more information by going to that website or clicking on the QR code. But there are 10 domains of the INSPECT criteria, and each is scored from 0 to 3, where 3 sort of indicates that it's being fully addressed, 0 is not at all. And in total, you can have scores ranging from 0 to 30. They're just sort of summed up across the different criteria. And we have an example here of one of the domains on the next slide, which is the application of the team effectiveness for implementation science model, right? So like Sean and Nicole mentioned earlier, the model that we showed here is we really want to emphasize that that be included in your proposal, and that the research is really addressing that model. And so we are going to be reviewing proposals based on the inclusion of that model. So you can see here a score of 0 would indicate that that model is not discussed at all, or if it is, it's cited, but the application is not really relevant to the study objectives or the study setting. A score of 1 on this domain would mean that the model is mentioned, but it's not linked to study objectives or hypotheses. The model may be appropriate for the proposal, but the rationale is not clearly stated, or the rationale is not really supported with citations from the literature. Moving on up the criteria, a score of 2 would indicate that the model is linked in some capacity to the study objectives and hypotheses and measures, but it may need some additional clarification. Going to a score of 3, the model is clearly described with the operationalization of theoretical constructs explicitly described within the proposal setting and population. It's used to frame the study in all aspects in terms of measurement, hypotheses, outcomes, etc. Now we have another example domain on the next slide. I'm going to just skip by it for the sake of time, but know that you can, again, look at these slides later for more information. So I mentioned that the proposals are also going to be reviewed with this community-based review. And so there are 3 review criteria for the community-based review. The first is strength of community engagement. Then there's potential impact on community, and then there's the impact on human health. And each of those will be equally weighted, 33% of the total score from each of these components. So strength of community engagement, evaluate the strength and appropriateness of the community partnership and community engagement approach. Do community partners share in the design, in the conduct of the project, the oversight, the funding? Will both partners benefit from the work, etc.? Potential impact on community. So we'll be evaluating the potential for the research to have a significant and positive impact on the individuals who are the participants in the community. That is the focus of the proposed research. And we'll be looking at both immediate, short-term impact as well as long-term impact of the work. And then impact on human health. So how important is funding this research to improving human health, either in the near future or distant future? So some key dates to keep in mind. Obviously, we're at the pre-application webinar right now, October 26th. The deadline for applications is December 2nd at 12 p.m. Pacific time. We will have a preliminary notice of award and scheduling of consultation meetings in early February 2023. Now, final funding is contingent on successful completion of IRB. We'll talk about that in a bit. The final approval and notice of award would be late in March 2023, and the funding period would be April 1st, 2023 to March 31st, 2024. So now let's talk a bit about the application process and what is needed to actually apply to this RFA. So if you go on, thank you. So we are going to be collecting applications via Qualtrics. And again, you can visit this link in order to see the application. You can access that QR code to visit the application. Any questions about the application platform or technical difficulties can be directed to the instep@health.ucsd.edu email address that's shown here. So the application is a 5-page application maximum that will be a combined PDF that would be uploaded into the Qualtrics link showed before. So this includes a 1-page specific aims, about a 1-page background and significance section, some preliminary studies or data collection analysis, if applicable, about a page there, about 2 pages for research design and methods, and then references should be included, but they're not included in the 5-page limit. Like mentioned before, we absolutely expect that this framework, this model here, be used throughout the project to guide the research questions, design, measure, selection, analysis, etc. So this must be in your applications and your proposals. We also require a 1-page community impact statement. So this should be about a 1-page document that includes the project title. We want to make sure that this is written at about an 8th grade reading level so that it can be reviewed by a non-scientist reviewer. And we don't want you to include your name on this page because it will get a masked review by an external community reviewer. And we want this statement to answer the questions that are displayed here. So how are you engaging and or partnering with the community? Will both partners benefit from the work? How does a community partner represent in a meaningful way the population under study, the impact, how important is the funding, etc. So that you could see really addresses the review criteria that was described previously. We also want you to submit with your application a 1-page dissemination plan. So this will describe plans for follow-up grants or proposals, any dissemination products that will be produced based on this, this project. And we want you to specify the target audience for those dissemination products, as well as plans for sharing relevant information or products with the community of focus. We also want you to provide a typical NIH biosketch for all investigators that are involved in the project. So this would be the PI, the co-investigator, any postdoctoral fellows or residents or graduate or medical students that are involved in the research. All biosketches should be compiled into a single PDF for upload. Budget. So we want you to provide a detailed budget, and we have, again, a link here of the NIH budget form that we want you to use for this project. So the funding period is 12 months. Requests for carry forward for up to 6 months will be considered. If any funds in the budget are designated for a community agency, we want to make clear that you provide a letter from that agency on their letterhead that describes the agency's support for the project, the agency's role in the project, the name, address, contact information, etc. Now, like mentioned before, while this is not to be included in your application, we really suggest that you submit IRB application at the same time as you are applying for the funding. Final funding, again, is contingent on successful IRB approval. So just to streamline that process, make sure there are no delays in funding, we suggest submitting IRB for approval at the same time. And I will pass it to Nicole. Thank you.
Great, thanks so much. So we have about 15 or so minutes left. We've tried to anticipate many of the common questions that you might have, but again, this is your opportunity to also add in the chat any other questions or comments that you have for us. So next slide, please. So first question here, do you have to be at UC San Diego to apply? No. However, we do want to raise your awareness to the eligibility criteria. So for principal investigators on the proposed pilot projects, you must be a faculty member at a research or academic institution. We highly encourage that community practitioners or partners in service settings that provide care for youth, project scientists, research trainees, postdocs, and other scholars, they're welcome to serve as co-PIs or co-investigators, depending on their role. So all eligible individuals are encouraged to apply as part of our aim to encourage early career investigators in being able to access funds. In instances where evenly scored proposals exist, we will prefer funding for early career investigators, as defined as those who have their terminal degree has been awarded in 10 years or less, in the past 10 years or less. And then I think finally PIs can be center affiliated or external, but studies must include a community partner, describe how community partners are part of the proposal. Okay, next slide. Okay, so the second question here, how much funding is available? So awards for $25,000 or $50,000 in direct costs are available. So when you describe your budget, please indicate which of these two funding amounts you are requesting. As a reminder, the funding period will start April 1st of next year of 2023 and extend for a full year through March 31st of 2024. And we've earmarked $100,000 for this next year's funding period. So the number of awards will be dependent on the number of competitive applications that we receive. Next slide. Okay, so what if my project is in a formative phase rather than an implementation phase? That's okay. And we understand that, again, the scope of these one-year projects may lend themselves more to being in a formative phase. We will review proposals at any stage of the research process. And again, we understand that proposals need to have an appropriate scope and be feasible for a one-year duration. So again, we encourage formative and developmental phases as well as those that are more advanced, kind of in an implementation or sustainment phase. Okay, next question here. Can I ask for a meeting or consultation about my proposal? Yes, you can. So you can request a 30-minute pre-application consultation with our InStep Center Methods Core. It includes Sean, Marissa, Greg, and others. And they're available to meet with you to refine your team effectiveness and implementation science methods. You can request a 30-minute consultation by visiting the link here or the QR code. I think it'll take you to a Qualtrics form and you'll be asked to submit some information about yourself and your questions. Next slide. Okay. Do I need to have a team effectiveness expert on my proposal to be successful? No, you don't need to have a team effectiveness research expert. Once your proposal is funded, you will obtain support from the InStep Methods Core. So again, if you can request a consultation with the Methods Core before your application, and certainly if you are funded, you will also be invited to consult with the Methods Core. You do need to have explicit reference to the team effectiveness for EDP implementation model. And again, if you need help with how to integrate that, you can request a 30-minute pre-application consultation. And I do see, I think, a comment in the chat. We'll be sure to address that. Okay, we'll be sure to address that, Patty. Okay, a few more questions. Can InStep Center members serve as co-investigators? Yes. So you are welcome to invite center members. This can include faculty, or trainees to be co-Is. They can contribute time, so there might be some cost savings there in your budget. And we think this might be particularly relevant for proposals that are describing use of secondary data analyses or data analysis from larger or previous center member projects. So yes, and if you have any questions about how you might go about requesting support or access to secondary data for analysis, please do email us at instep@health.ucsd.edu. Okay, next slide. Okay, when is the deadline to submit? So the deadline is December 2nd at noon Pacific. Okay, so now we can open it up to your questions. And let's start here. So first question here is from Patty. So since special education services reach up to age 22, I'm wondering if the 18 to 22 age group could be a focus in an application. Is there an age limit at 18, since InStep is child mental health focused? I'm seeing a thumbs up from Lauren that we are happy to extend the age limit to those in the transition age period, so I think up to 22. Greg and Lauren, I invite your comments about if there is a specific age limit that we need to make applicants aware of.
I'll just add, great question, Patty. The schools are a primary service system for children and youth with mental health or developmental needs. And so since that service system goes up to 22, we certainly would include those transition age youth. So there's not a hard stop at 18. I think this is a really good example of a good rationale for going to 22. So thank you for that question.
Thanks, Patty. Thanks, Lauren. Okay, a question from our very own Greg. Where can applicants find a list of InStep Center members? And I think for now, the website is our best place for that. And again, our website is instep.ucsd.edu. That should include a listing of all of the directors, investigators, core and affiliated trainees. So that should be a good place to go. Okay, let's see the next question. Will there be additional RFAs in the future? Yes. This is an annual call. So for the next 5 years, we will be offering this pilot funding opportunity. Okay, what about consideration of interventions for parents involved with child welfare with the goal of improving child well-being? Well, I think that is an absolutely excellent and appropriate topic for this call. I'm not sure what I can say beyond that other than it sounds very relevant and appropriate. And in fact, one of our projects that will be supported by the center is focused on child welfare service settings. So definitely this is, I think, of interest and aligns with the RFA.
Yeah, I think one thing to be cognizant of there is that the center is funded by the NIMH. And so any application that's going to be in whatever sector has to show that linkage with child mental health. So that could be done in a number of ways. And I think our team here would be happy to talk through those issues if need be.
I'll also, that's a good point, Greg. And then I'll just also add that that the focus on the clinical intervention may be part of the application, but as a reminder, the review criteria really, they're focused on the implementation strategies in which and the team-based implementation strategies and mechanisms. So it would be very important to include that in addition to any focus on the clinical intervention.
Thank you, Lauren and Greg, and thanks, Ryan, for that great question. I am not seeing any other questions, but some good information about where to access our InStep people and resources. So without seeing other questions yet, I'll invite you to review our how to contact us. So again, our email is instep@health.ucsd.edu. The request for applications, it's on our website and also accessible via this link. We can be found at instep@ucsd.edu. Give us a follow at UCSD Alacrity on Twitter. And if you'd like to join our email distribution list, if you're not already on it, you can scan this link here. It will take you to another Qualtrics form. I think it's fairly simple. We ask your name and your email address, and you'll receive all of our InStep Center communications. So I think with that, we may be able to close a little bit early. We really thank you for your time and your great questions. Our plan is to send out the link to the recording on our YouTube channel, as well as this collection of slides within the next few days. So again, thank you so much for your time and for joining us. We look forward to seeing your applications. Lauren, Greg, Marissa, Sean, anything else you'd like to add?
No, I'm just excited for everyone who's here and looking forward to the applications that coming in. And this is an emerging area of implementation science in mental health. And so kind of really looking forward to you joining us on this journey. So thank you.
Thanks, folks.